One thing we touched on last time, which I was quite excited about because it's based around testosterone and how testosterone in men is dropping. We were discussing the average age of men that are coming to you and asking for hair transplants. Have you seen that that average age decline? Are there younger men coming towards your clinic, or or was it the fact that there's more exposure around the subject? Which kind of route was it?
I think a bit of both. Some doctors like myself, because I specialize in fixing receding hairline. So most of the patients who come to see me is they want to have the hairline done because that's my area of specialty. And naturally, my patient is just a little bit younger compared to some of the general population. And it's not necessarily always the case because some practice have approach differently. But for me, generally, is the younger patients who look is the early stage of hair loss, been on medications, want to restore the hairline. So my practice generally have a younger group of patients. But actually, the latest ISHRS results on the statistic actually show most of the hair transplant worldwide, not just mine, worldwide, across all the members, actually, most of them are under 35 years of age, majority of the hair transplant surgery.
Wow.
So can it be because hair loss is a bit younger? I'm not sure about that, but I think we are more aware of it, and we are looking after ourselves a little bit more. Last time you were talking, could it be we were looking at more at the social media? We spend more time on the
Vanity.
selfie and spend more time on
yeah.
taking nice photo, or it's like everyone has got a device in their pocket now. In fact, what I'm using now is a phone to do this. So inevitably, it's gonna have an effect on how we look and ourselves. So maybe we are in a selfie generation or era, so we are more self-conscious about it, or maybe just we have always experienced hair loss around at this age, and I think also patients and are generally a little bit more educated nowadays, so they because information is so readily available, we can Google things and Google will find us an answer. So I found that in the last 10 years or so through my career in hair transplant, patients are getting more and more educated. So a lot of the patients I see nowadays, they have already read through a lot of material, do a lot of research, and they're aware of what the treatment options available to them. And when they come to see me, they're fairly aware of what's work and what it doesn't.